We were grocery shopping. And I got a FaceTime incoming from his coworker, and she kind of explained everything that happened and said that Shay was being sent to the ER. So I left my cart full of groceries and headed right up to Parkview.
I am an exercise physiologist. I work in the cardiac rehab department at Parkview, and I went to the gym multiple times a week. No medications and good health, so I thought. About 2 hours into my shift, I started to feel a little funny. My vision started blurring in my left eye. So when I sat down to do some paperwork, everything was spinning. So I leaned over to one of my coworkers and I said, I think I'm gonna pass out. So instantly they all rushed me into a chair, and next thing I know, they're wheeling me down to the ER. Once I got into the ER, I felt like a heaviness on the left side of my face. My lips were drooping down, my tongue started going numb. So that was really the first time that I started to get a little nervous or think that this might be a little bit more serious than I had first thought.
I am a nurse in the surgical trauma ICU. We see all stroke patients at Parkview, so it felt very close to home. I was kind of in shock that this was happening to my husband. The first couple days we were there, I was more in, I would say, nurse mode than I was in wife mode. It was hard. I mean, looking at the monitor and knowing what all those numbers meant, in that moment, I just wish I had no medical background. I think that in that case, ignorance would have been bliss. But then I really had to take a step back and trust my coworkers and really put faith into them. Without them, who knows where we would be right now.
So when we first saw Shay, neurologists and cardiologists were already involved. Dr. Thomas from cardiology performed an echo that demonstrated two findings. One was a septal defect in his heart that typically is present from birth, and a second issue where he had a small filamentous lesion coming off of his aortic valve called a Lambles. So the initial treatment for both these issues is usually non-surgical. His physicians had placed him on blood thinners appropriately. However, he subsequently developed more symptoms while he was on the blood thinners. So we decided to take Shay to the operating room.
Whenever we started talking about open heart surgery, I was so nervous. I didn't know what to expect. It was a very different world for me.
I was very nervous. I mean, I deal with open heart surgeries at work every day. It's very different when it's happening to you.
He has no long-term ill effects of this. It doesn't get any better than that. I think the takeaway lesson here is no matter how young and healthy you feel you are, if you're having something atypical, what happens is you can develop irreversible problems with your brain or with your heart by ignoring symptoms.
I just feel so lucky that I am still here. I mean, I have 2 young children and a wife and family and everything, so I'm just so thankful to Parkview and all my doctors and nurses and the entire Parkview staff. I'm just so blessed and thankful.
I feel like we've lived a lot of life in the last just 6 months. I was actually supposed to return to work from my maternity leave that next week. So my manager sent out a PTO request, and it was only to my unit. So just within my unit, people donated enough PTO for me to have an additional month off to be home with my husband and our 2 kids. I mean, that just goes to show how great that they all are. It was really nice to have my Parkview family there.